Hi, I'm Dr. Pooja Tripathi. I'm a physiotherapist and a yoga therapist from past 16 years. I am here to talk about PCOS. Thank you, OoWomaniya, for giving me this opportunity to share my knowledge. So not only I'm a physio, but also I was a patient of PCOS before and I have suffered for years together because of it. But thank God, by doing these exercises, I actually got out of it and now I have 2 healthy children. So let's first start what is PCOS. So PCOS is nothing but you have got multiple cysts in your ovaries which causes problem in your reproductive cycle. So your periods may not be regular. The second can be psychological effects. The third can be metabolic effects, and you get into a vicious cycle where because of PCOS you have diabetes, because of diabetes you have thyroid. So let's come out of this cycle by understanding how the PCOS came. So if the PCOS has come because of the lifestyle which you are following, then change your lifestyle. So start sleeping for 6 to 8 hours, start eating healthy food, okay, healthy and balanced food, and do exercises. Just by doing these changes, and always hydrate. Just by doing these changes itself, you will see lot of changes in your PCOS. But yes, if you are genetically blessed by it and it is there from years together, then you need to be regular for next 1 or 2 years with the thing which I am saying. Balanced diet remains the same. Exercises, there are basically 5 exercises for PCOS. One very important is cardio. Cardio is what you can start your jogging, swimming, cycling, walking, dancing, Zumba, aerobics. All these things comes into cardio. So 30 minutes of cardio at least 5 days a week is a must thing. Second very important, which many patients actually miss out, is strengthening. Strengthening is very, very important. Now strengthening can be either by using an external weight or by using your own weight like a plank or by doing squats and all that stuff. So calisthenics and strengthening is must. Again, 3 days a week, 30 minutes is very important for PCOS patient. Another thing which you can do is high intensity interval training, where you can have 7 stations, and in 7 stations 7 different exercises. For example, 1 mountain climber, 1 squats, 1 push-ups, and 7 different stations. You keep changing every 40-45 seconds and continue the cycle for say 5 or 6 times, and this is high intensity training. Of course, warm up and cool down is very, very important. The fourth very important exercise is yoga, and today I will be demonstrating few yoga poses. Asana is child pose, where you sit with your legs fold. If you can't sit like this, you can even keep a pillow or a towel below down and just slide your hands forward. It's called child pose. And stretch your back, which is very important. Make sure your buttocks doesn't come up. So your buttocks are down and you keep breathing in this pose as much time as possible. The second is just come on to the crawl position from the similar pose and do cat and camel. So breathe in, you look up, and breathe out, you look down. So breathe in, up, breathe out, down. The third pose is you do Naukasana. So you come back to sitting and you just stretch your hand and legs and be in this pose. Make sure your back is straight and you are not going like this. So your back is completely. Very important is in none of the poses you are holding your breath. So you're breathing in and out, and you're doing each pose 5 to 10 times, as many times as possible for you. From here we go to butterfly pose. It is very important that your hip turns out and your knee is stout, and try to do just some butterfly thing, and then do a butterfly stretch. So you breathe in and you breathe out and come down and hold this pose as much time as possible. Now in that same butterfly pose, you can do a sleeping butterfly. So where you actually sleep down with your hands up and legs facing out. The main point here is we should open our hip, which is very important. If you're comfortable here, you can even do a fish pose, where you can come onto your elbow and look up, and that becomes a fish pose. Then pause. Next is mill churning pose. You extend both the legs out and you try to do a circular movement. Breathe in at one cycle and breathe out at the other cycle. and you do other way around as well. Similarly, you do a hamstring stretch and go from side and hold this pose for 20 seconds and may do 5 to 8 repetitions. Okay. Also, you can do Shalabhasana if you are comfortable. That is shoulder stand. You get into the thing and come up and hold this pose. If you are comfortable, then try to take the leg as much back as possible. The last pose is forward bend pose. You can extend your leg and try to come down and put your legs and head down and hold this pose for as much time as possible. So basically, if you are a PCOS patient, it is very important to do abdominal exercise, back strengthening exercise, hip opener exercise and Kegels. Along with that, you can do pranayam. Pranayam, you can do Bastrika, you can do Alom Vilom Pranayam, you can do Brahmari Pranayam, which is very good. And just doing these practices regularly, you can come out of PCOS. So stay healthy, stay happy.